Welcome back to Drugs and Behavior with Dr. Goodin. Next we'll be talking about Chapter 14, Prescription Drugs, Over-the-Counter Drugs, and Dietary Supplements. Prescription drugs are behind the pharmacy counter, and their purchase and use require the submission of a written prescription form with an appropriate signature or other secure mode of communication which certifies that you are taking one of these drugs for a medical condition at a dosage level appropriate for that condition. The quantity of a drug that you are allowed to purchase at any one time is specified, along with a limit on the number of prescription refills. This offers some control over the drugs used for an extended period of time. Depending on the drug and the state, physicians and sometimes nurse practitioners and physician assistants can prescribe drugs. Only registered pharmacists are permitted to fill these prescriptions and dispense the drugs to the consumer. There are also over-the-counter drugs on the shelves available for you to buy. You are your own physician. The FDA oversees prescription drugs and over-the-counter drugs. The strength and concentration of active ingredients in over-the-counter drugs, or OTC drugs, must have a great margin of safety, greater than the active ingredients of prescription drugs, to justify the wide availability to the general public under such unsupervised conditions. The third group is dietary supplements, which are relatively new, but have become in recent years a major category of drugstore products, generally available to the public in the form of vitamin or herbal products. Dietary supplements do not have to be proven effective. They are not regulated by the FDA. When we get medicine at a pharmacy, we trust that we are getting only what we ask for, nothing more or less. This assumption could not be made prior to 1906. The 1906 Act made it so that all active ingredients in drugs would be clearly and accurately identified on the label. It wasn't until 1938 that drugs and cosmetic products had to be accurately identified. Drug companies were required to demonstrate by research studies that new drugs were safe before they could be marketed commercially. An amendment in 1962 made it so that drug companies were required to prove the new drugs were effective as well as safe. The FDA now primarily oversees approval of new prescription drugs and the setting of standards for over-the-counter drugs. There are several phases of approval for a new prescription drug through the FDA. It begins in laboratories of drug companies or research facilities around the world, identifying the composition of a new compound, the purification of its active ingredients, and a preliminary determination of any possible toxic effects. Toxicity tests on 2 or more species of live animals are carried out to determine the lethal dose, 50, dosage of the compound. Tests are also done on pregnant animals to determine whether administration of the compound might produce birth defects in humans. Depending on the purpose of the drug, chronic or acute use, it is tested in that way. The drug company then notifies the FDA for an application known as the Notice of Claimed Investigational Exemption for a new drug that the compound has a promise as a new prescription drug and that permission is requested to conduct testing in humans. In the first stage of clinical studies called Phase 1 trials, about 10 to 100 healthy volunteers, usually prison inmates or medical students, are administered the drug and certain pharmacological questions are answered: absorption rate, side effects, range of dosages, safety, and schedules of administration. In Phase 2 trials, the new drug is tested on 100 to 500 patients with a medical condition or illness that the drug is intended to treat. The patients must have no other health issues. The studies are done in the double-blind manner. If Phase 1 and 2 trials are successful, Phase 3 trials are investigated in the population, evaluating 1,000 to 3,000 patients for safety, effectiveness, and proper dosage levels, and a closer examination of possible side effects. Phase 3 studies are lengthy and expensive. 3 phases may take 3 years or more, and if the drug company considers the results satisfactory, a new drug application is submitted to the FDA, including all the data on the animal testing and clinical trials. Less than 30% of all compounds the drug companies consider worthy of human clinical trials make it this far. The FDA has 6 months to review the application and accept or reject the new drug for commercial marketing. Phase 4 trials involve monitoring the new drug after release for commercial use for any unforeseen side effect or toxic reactions. Physicians are informed if there is new information on side effects, but it is rare that a drug approval is rescinded. The drug company receives a patent with a fixed duration of 20 years from the initial application, after which time generic forms of it can be manufactured and sold to the public. When a patent expires, some companies seek to make their drug over the counter. Since 1984, the FDA has required that all generic drugs demonstrate bioequivalence with respect to the original brand name drug, meaning that both versions must be shown to be chemically and pharmacologically identical. There may still be differences in bioavailability of generic versions having to do with the rates with which drug enters the bloodstream and reaches the site of action. In other words, they may have different therapeutic effects. FDA approval can be expedited on occasion in special circumstances for certain seriously ill patients. This has been used for AIDS to approve a drug in as little as 97 days. Over-the-counter drugs are reviewed for safety, effectiveness, and label integrity, resulting in higher dosages available and more prescription drugs available in over-the-counter format, and more informative labels. FDA-approved drugs are safe to the extent that they can be proven during the given amount of evaluation time. There is a balance between approving the drug quickly in order to provide treatment to those who need it and making sure it is safe for the consumer. FDA approval now protects medical device makers from being sued. Now, onto this slide. There is danger when drugs are not used according to recommendations or when they are misused against recommended dosage levels. Prescription or over-the-counter drugs are sometimes used as agents for suicide attempts, about 95% of the time. There are many unintentional drug misuse cases, especially among the elderly, with prescription drugs. Physicians must keep up with a complex array of possible collateral actions between drugs. Prescription errors do occur, so safeguards have been instituted as much as possible. Prescription drug abuse is common, especially with opioid medications and stimulant medications. OxyContin is well known to be abused, and the concept of doctor shopping is a practice that is being shut down. This involves a patient managing to secure multiple prescriptions for drugs from multiple doctors in order to abuse them. Native Americans treated pain and fever by chewing willow bark, which contained salicylic acid, and was later renamed aspirin in a different formulation. Aspirin is anti-inflammatory in that it relieves inflammation and tenderness in joints of the body. It is an antipyretic in that it lowers elevated body temperature to help when the body is fighting infection. Side effects of aspirin may include gastric bleeding, slow blood clotting, and Reye's syndrome, a rare but very dangerous condition marked by lethargy, nausea, and severe vomiting, disorientation, and coma. Acetaminophen is an OTC drug alternative to aspirin, used for an analgesic and antipyretic purposes. It is not an anti-inflammatory. It is better known as Tylenol. It does not produce gastric distress or interfere with blood clotting. It may cause liver damage, kidney damage, and blood hemorrhaging issues when combined with other prescription anti-clotting medications. Ibuprofen is marketed as an over-the-counter drug commonly known as Advil. It is effective in reducing pain, inflammation, and elevated temperature due to fever. Ibuprofen has been found to be particularly effective in the treatment of menstrual cramps. As with aspirin, it blocks the production of prostaglandins. There is some danger of gastric distress and kidney damage or failure. Naproxen is the newest over-the-counter analgesic drug and is known under the brand named Aleve. It lasts longer than the other drugs and may cause gastric distress, bleeding, ulceration, or perforation. Common suicide attempts include one of these over-the-counter drugs and alcohol, which makes them far more dangerous. Sleep aids involve an active ingredient known as diphenhydramine, an antihistamine that is also common in drugs such as Benadryl. Some brand names include Mital and Unisom, while others are combined with other drugs such as Tylenol PM. Cough and cold remedies seek to reduce the symptoms of cold since they cannot be cured. With all drugs, the remedy is dependent on the symptoms. Antitussive agents are called suppressants for the control of a cough. An expectorant reduces the thickness of mucus in the throat, impacting the mucus and making it easier to cough up. A decongestant widens blocked nasal passages and sinuses. An antihistamine relieves the itching, sneezing, teary eyes, and runny nose. The analgesic and antipyretic agent reduces sinus pain, headache, or fever. It should be noted that antihistamines or CNS depressants may cause sleepiness during the daytime or while driving. Several remedies contain alcohol and may be abused. Some cough and cold remedies may not be appropriate for children under the age of 4. Some cough and cold remedies often contain dextromethorphan, or DMX, an opioid used to suppress coughing, which is commonly abused in a process called robotripping or skittling. Recent attempts in 2008 sought to regulate the ability to obtain prescription drugs via the internet. Now on to dietary supplements. Dietary supplements look good because they are natural products and are used by over 18% of American adults. They are used without communication with a physician or other health professional. They are often sold in combination with food and drink products. There is less regulation because they are not classified as drugs and do not have to be tested for safety and effectiveness, but do have to be tested for contaminants and be accurately labeled to reflect the contents. They don't put milligrams usually, but rather put a percentage of the required daily allowance, which is very controversial and changes often. They are not allowed to say that they cure or treat a specific disease, though they can claim benefit for certain periods of a life, as in helps with old age. The definition of a disease is somewhat precarious in these situations, as these dietary supplements claim to relieve joint pain, but not arthritis. The FDA only seems to step in when there are a multitude of customer complaints and physical damages, usually reported by hospitals. I will see you in Chapter 15.